to Kumasi away from the power outages. The Asantehene Otumfuo said to the second has toured some health project sites in the Ashanti region which are either stalled or under construction. Prominent among the facilities visited is the Sewua Regional Hospital, which is 90% completed but left unattended to, with deplorable roads impeding its usage. The Asantehene inspected the pace of work at the project sites while advocating for their early completion. Nana Boache Iyadom joined the tour and has filed this report.
The Asantehene visited 3 project sites in the Ashanti region, including the ongoing renovation works he is spearheading at the Komfo-Anokye Teaching Hospital, the stalled Sewua Regional Hospital, and the Mother and Baby Unit at the Menchia Hospital. The comprehensive renovation and modernization of the Komfo-Anokye Teaching Hospital has reached a 60% completion rate. Otumfuo has been leading the HillCath project through a $10 million public fundraising exercise to renovate the traditional wards of the hospital. Samuel Edubuachi is the chairman of the HillCath project.
Komfo-Anokye is not going to leak any further when it rains. One of the major problems of Komfo-Anokye was the fact that if it rained today for 2 weeks, some of the wards will be leaking. We are privileged and happy to mention that the last rains that we have experienced, not even one leakage. The king is very pleased. The progress of work so far, because of the space concerns, the hospital is still in session. So what is happening is that we'll be doing it in phases. So currently, the A4, A5 demolition has happened. The things have almost arrived. So as it arrives, we'll be making sure that just matter of fixing those fixtures and fittings that we have imported to be able to do this.
The Asantehene later inspected the Sewua Hospital project, which is to serve as a regional hospital. The facility, already 90% complete, is left unattended with deplorable roads impeding its usage. Dr. Emmanuel Tinkrine is the Ashanti Regional Health Director.
The hospital has been completed for the past 1 year. What we need to do is to get electricity connected to the hospital. You know, we need a transformer that can power all the machines. And the current electricity that we have will not be enough to power the machines. That's the reason why we believe that we need a new machine. So fortunately, ECG has connected us from the main line and giving us 2 transformers. All that we need to do now is to connect the hospital to the main lines, and then we can test run the machines and then train the staff and then open the facility. Also the road, you saw it yourself. We need to put it in shape.
Dr. Ejakupoku, who spoke on behalf of the Asantehene, says the visit is to advocate for the completion of the projects.
It is part of his activity to occasionally go around to see the developmental activities going on. Sewua Regional Hospital is very significant and he must come and see. We've been told that it's about 90% completed. So he's here to find out why it's not moving and to see how he can't also support the program to go. Definitely he will have to put in his advocacy skills to get us moved.
The Asantehene ended his inspection at the construction of the baby and mother unit at the Menchia Hospital.
Well, the Asantehene is expected to add up his voice and call on government to speed up its work on these sites to ensure that these projects are completed in no time. For Joy News, my name is Nana Boache Iyadom, Kumasi.